Hello, everyone. My name is Melissa. I am a nurse here with the Villages Health, as well as a population health specialist. This seminar we're going to do is on exercise and physical activity. So first, let's get a bit of a definition. These two words, exercise and physical activity, you'll hear interchangeably, but they are a bit different. So the term exercise is an activity that's specifically planned. It's some type of structured, planned activity that is repetitive as well, like weight training, Tai Chi, or even aerobics classes. Now, on the other hand, physical activity, these are the activities that get your body moving. Not necessarily those planned or structured things, but things like gardening, walking your dog, raking your leaves, even taking stairs instead of an elevator. So exercise is the planned, structured, repetitive type activities. Physical activity is anything else that's going to get your body moving. So some benefits of physical activity, so that body movement, first is it helps with sleep. So it's actually been shown to reduce the length of time that it takes you to fall asleep. So the time that you lay your head down on the pillow until you're actively sleeping reduces the length of time there. It also reduces the night awakenings that happen. Now, this is aside from getting up to use the restroom. This would be night awakenings in between sleep for any other reason. Sleep also increases physical activity also has been shown to increase the time in your deep sleep, that REM sleep that we know our body needs to reprogram and refunction. Physical activity also has been shown to reduce our daytime sleepiness. So all benefits here that are shown from physical activity to help with our sleep. Also, physical activity promotes acute improvements in our executive function, which is our organization and planning, those executive function skills that we have and that we need for our daily tasks. Some other benefits of physical activity, it has been proven to reduce the risk of clinical depression. And if you do have a diagnosis of depression, it has been proven to reduce the symptoms. So overall, if you have a clinical diagnosis of depression, it has been proven to reduce your symptoms. If there is no diagnosis, it reduces your risk of developing clinical depression. Physical activity has also been proven to reduce the symptoms of anxiety. Now, this is both chronic and acute. Acute being maybe you have family coming over in a couple weekends and you have a lot of things to do. You have to get the house ready. You have to prepare where everyone's going to sleep. You have to prepare your meals, things like that. Chronic anxiety, this is something maybe that you've had for a while, you've been living with and working with the doctor to help keep it at a minimum. Now, physical activity has been proven to reduce the symptoms for both types of anxiety. It also improves our overall perceived quality of life. As well as in older adults, those 65 and over, physical activity has been shown to reduce the risk of falls and fall-related injuries. That's a big one. Some immediate benefits that happen when you start physical activities. You'll see a reduction in your blood pressure. It may only be a few points, but if you do have a diagnosis of hypertension or high blood pressure, or if you're borderline, a few points will make a big difference. Physical activity also helps improve our insulin sensitivity. So our pancreas secretes insulin to help with glucose regulation in our body, to help with our sugar levels. So physical activity helps with that. It helps with how the insulin is used. Immediately, when a physical activity regimen is started, it helps improve with our sleep, reduces anxiety, and helps improve cognition. So again, all benefits here, and these here that you see on the screen are the immediate benefits that are noted. Physical activity has also been proven to reduce the risk of certain things. And some of these on here you might already know of, but some of these might come as a surprise. So physical activity reduces the risk of weight gain in being overweight or obese. It also reduces the risk of dementia. So that's one that some people may not be aware. So moving your body, getting your blood flowing throughout the body, and it reduces your risk of developing a diagnosis of dementia, even some cognitive impairment. Physical activity has also been shown to reduce the risk of falls and fall-related injuries. There's a study that shows 1 in 3 older adults over the age of 65 will fall every year. That's a very high number, and it's scary. You don't want to be that statistic. So adding in some type of physical activity in your daily tasks, your day-to-day regimen is very important. Now, this is the one that surprised most people. So physical activity has been proven to reduce the risk of certain cancers. So we have breast, colon, bladder, endometrium, esophageal, kidney, lung, and stomach. So if we can reduce the risk of developing these types of cancers from doing physical activity, that's important. That's a big one. If you do have certain diagnoses, certain diseases, physical activity can slow the progression for certain existing conditions. So that's important as well. You already have a diagnosis of a certain type of disease. If you can start some physical activity and slow the progression or slow the conditions and symptoms that you're having, that would be the goal. Now, this slide here that we can see, this is for adults of all ages. Physical activity will lower your risk for all-cause mortality. This is dying for any reason. So if you're doing nothing, if you're living that sedentary lifestyle, the recent study has shown if you can start with even 2 minutes a day, it significantly reduces your risk of dying for any reason. 2 minutes. We can all do 2 minutes, whether it be walking around your kitchen, walking around your house, walking to the end of your driveway and back for 2 minutes. That's definitely a doable goal that we can all start with. So it lowers that risk of all-cause mortality. It also lowers your risk for cardiovascular disease or mortality, so including heart disease and stroke, as well as high blood pressure, your hypertension, and even type 2 diabetes. Now, the third one down here you'll see is the cancer that we discussed as well. So physical activity lowers your risk of certain cancers. So bladder, breast, colon, endometrium, esophagus, kidney, stomach, and lung. And that bottom one there is the big one. That's the one that most people are very surprised to hear. So this next slide also, we talked about brain health, reducing the risk of dementia, helps improve our cognitive function, as well as quality of life, sleep, the feelings of anxiety and depression with some of the symptoms. It helps with those symptoms. And then there at the bottom, with our weight. So reduces the risk of excessive weight gain because you're not sitting doing nothing. You're up moving your body. You're getting your blood pumping, whether it be walking the dog, whether it be taking a walk to the mailbox instead of driving the golf cart, anything that's going to get your body moving. Now here's the falls that we talked about. Physical activity reduces your risk for falling as well as fall-related injuries. Then there at the bottom, physical activity helps with your physical function in older adults with and without any frailties. So very important for older adults to make sure you're incorporating some type of physical activity in your daily routine. So here are those pre-existing conditions. So if you already have a diagnosis of any of these, on the left, breast cancer, colorectal, prostate cancer, osteoarthritis, and hypertension, which is the high blood pressure, doing some type of physical activity reduces your risk for certain things with these. So for the breast cancer, it reduces your risk of all cause and breast cancer mortality. So it reduces your risk for dying from breast cancer as well as dying for any reason. That's the same with the colorectal cancer. With the prostate cancer, doing some physical activity reduces your risk of dying from the cancer or the symptoms from that cancer. Fourth one down, the osteoarthritis. Physical activity helps decrease the pain. So with the arthritic pains, you have those stiffness and pains in your joints. Starting a physical activity regimen helps decrease those symptoms that you're having, helps with the pain, helps with the stiffness. They say motion is lotion. So doing the physical activity is beneficial to get those joints moving a bit easier for you. And there at the bottom, if you already have a diagnosis of hypertension or high blood pressure, physical activity reduces your risks of the cardiovascular disease progressing. So of having any other issues that occur with the blood pressure, putting your risk for heart disease and stroke higher, physical activity keeps that risk at a low. It also reduces the risk of your blood pressure going up over time. So if you do have a stabilized blood pressure, physical activity will hopefully keep it in that range where you and your doctor want it. Now here we have a few others. So if you already have some of these pre-existing conditions, physical activity help with these as well. So if you have diabetes, physical activity reduces your risk of cardiovascular mortality, cardiovascular death. It also can reduce the progression of certain disease indicators. Like with diabetes, your A1C, that's that 3-month average of your blood sugars. If the physical activity routine is started, it may keep your A1C at a certain level and keep it from going up. Also keeps your blood pressure and your blood cholesterol, your blood lipids, as well as your BMI, your body mass index, keeps them from progressing and getting higher, which is the goal. Some other diseases, the multiple sclerosis, dementia, ADHD, schizophrenia, Parkinson's, and even stroke symptoms, or I'm sorry, stroke patients. If you have any of these pre-existing conditions, physical activity can help improve your symptoms from that. It can help improve your walking, your fitness, and your cognition. So overall, everything that we've seen in these slides here are beneficial. So doing some type of physical activity will benefit you, whether or not you have some pre-existing conditions or not. If you don't, hopefully this will keep you from developing them. If you do have some of these conditions, hopefully it'll keep them from getting worse and progressing. So this is a nice little picture that we have here on the right. You'll see there's red at the top, green at the bottom. This is the relationship among moderate to vigorous physical activity and a sedentary lifestyle. So you can see on the left, this is the daily sitting time. And then on the bottom, going towards the right, moderate to vigorous physical activity. So we have the guy sitting here up in the red. He's sitting the majority of every day. He's living a sedentary lifestyle, really doing nothing. He's just sitting, watching TV, getting up, very minimal. We have the guy here in the green walking. He's up walking. He's doing some physical activity. The risk of all-cause mortality for this guy in the red is very high. He's also at a higher risk for dying from cardiovascular disease or even developing cardiovascular disease. He's at a higher risk for developing type 2 diabetes, even developing certain cancers, so colon, endometrial, and lung cancers. Living that sedentary lifestyle puts you at a higher risk for developing any of these things, or even all-cause mortality, dying for any reason. Now, the guy here in the green, where he's up walking, he's at a lower risk because he's getting his body moving, he's active. That moderate to vigorous physical activity that we need in our day-to-day lifestyle, it puts us at a lower risk for these items listed. So goal is to move more and sit less. So when you're trying to incorporate or start up a new physical activity and exercise routine, you want to make sure you're including all 4 types of exercise. Those types are endurance, strength, balance, and flexibility. So we'll go over these in a little bit more detail. So the first one is endurance. These are also sometimes called the aerobic exercises or cardiovascular activities. These are the ones that are going to get your breathing and your heart rate a little elevated. The endurance exercises help to keep your heart, lungs, and circulatory system healthy. Again, because it's getting that oxygen-rich blood pumping throughout your body where it's needed to keep everything functioning as it should. The endurance activities help improve your overall fitness and well-being. They can also delay or even prevent certain health conditions like diabetes, breast and colon cancers, and even heart disease. These physical activities also help us improve the ability to conduct our daily activities. So these are very important, trying to incorporate this every day. Some examples of endurance activities are brisk walking or jogging, doing some yard work like push mowing, raking leaves, or digging, even dancing. You can dance in your living room, you can dance at the squares, just some type of dancing, really moving your body. Swimming, biking, climbing stairs or hills, although I'm not sure how many hills we have around this area. Playing tennis, basketball, pickleball, things like that. The ones that are going to get your breathing and your heart rate elevated are considered in this endurance category. So the goal is to build up to at least 150 minutes of moderate intensity every week. Trying again to incorporate some of this type of activity every single day if you can. Now, the vigorous activity, moderate to vigorous activity, in order to see if you're to that level, you can do a talk test. So what that means is if you're, say, doing some brisk walking, if you can have a conversation out loud, if you can talk, but not sing, then you're at the right activity level. If you can sing out loud, you're not quite to that moderate vigorous level. So you should be able to talk out loud, but you should not have enough air to be able to sing out loud. Now, if you're not a singer, that's okay. It's still a good test to be able to practice and see where you are with your activity level. So you should be able to talk, but not sing out loud. Now, always make sure you have you're safe when you're doing these activities. So if your body's telling you to slow down, you should slow down. You need to listen to your body. You are your body's best advocate. So whatever it's telling you, you should definitely listen. Before you do any of the endurance activities, always warm up and cool down. You want to make sure you're warming your muscles up before you do any type of activities to hopefully avoid any injury. Also make sure you're staying hydrated. Make sure you always have your water with you. And then use safety equipment if needed. If you're going on a bike ride, wear a helmet. We have one brain, so we want to make sure we protect it and we're staying safe doing whatever activities that we have selected. So this is a wonderful website that is a good one to warm up to. It's from silversneakers.com. It's warm-up exercises before walk. So if you're starting some type of physical activity, this would be a great exercise just to do before. Then you can also do this at the end to kind of help cool off your muscles and calm from whatever the activity was that you're doing. Now, next are strength exercises. These help improve our muscle strength, our balance, our muscle tone, as well as if you do have some lower body issues, these really help with your fall prevention. So making sure you're incorporating the strength exercises in your lower body is very important. This strength exercises involve lifting or pushing weights. So the goal would be to build up to at least 30 minutes of strength training on all of your muscle groups 2 or more days a week. Now, this next part is the most important. So don't exercise the same muscle group on any 2 consecutive days. Reason being, when you're doing your strength exercises, that causes microscopic tears in your muscles. So if you continue day to day to work those same muscles, that can cause some larger tears and pose you at a big injury risk. So say today you want to start with your upper body and your arms. Tomorrow, maybe do your core. Then the next day you can do your legs and your lower body. And then by the day after that, you'll be ready again to do your upper body and your arms. That way we're giving your upper body and arms a couple days to rest and recuperate and build back up from today where we started. So very important, make sure you're working all of your muscle groups, but not on any 2 consecutive days. Now with the safety issues, the safety concerns for the strength training, you want to start lightly. You'll slowly add weight or resistance over time. So you want to aim somewhere between hard and very hard for you to lift or push the weight. A little side piece here, if you cannot lift or push a weight 8 times in a row, it's too heavy. So lighten up whatever it is that you're doing. You should lift for 3 seconds, hold for 1, and then return for 3. And your goal would be to build to 10 to 15 repetitions for each exercise that you're doing. But remember, start slow, start light, and then slowly work your way up because you don't want to hurt yourself while you're doing these exercises. Slowly build up. Let your body get used to this new routine that you're starting. So this is one example of some strength exercises that you can try. You can even do these at your home. You see he has a very secure chair. All 4 feet are on the floor. Make sure you don't have one that has wheels on it or you don't want a rocking chair. He has 1 foot firmly on the floor. Both hands are holding onto the chair. He has his knee bent at a 90-degree angle, and he's just going to bring that leg up. Just slow and steady and just count. Now you're going to build, like we said earlier, to 10 to 15. And then once you do that with your left leg, then you'll switch. This foot will go on the ground. The right leg will go up. And he'll do those 10 to 15, like a donkey kick. You're keeping that angle, but you're just bringing your leg up. So that's called the knee curl strength exercise. And again, you can do these in your home. You can even do them in your pajamas if you want to. So next we'll talk about the balance exercises. These are very, very important. These help prevent falls, which we don't want to be that 1 in 3. So doing these exercises are very important, trying to do them every day. Now these exercises can be done anytime, anywhere, and as often as you like. These, again, you want to make sure you include lower body strength exercises to make sure you're keeping those muscles in your legs toned and strong to keep you at a lower risk for falls. And for your balance exercises, make sure you always have a chair or a wall or counter, something that you can hold on to for support, because you don't want to fall while you're doing your balance exercises. That would defeat the purpose. So make sure you always have something to hold on to just in case. Now it says these can be done anytime, anywhere. So you can do these in your kitchen in the morning when you're making your coffee. You can do some of these when you're standing in line at the grocery store. Literally, you can do these anytime and anywhere, and you should do them often. So here's one example of a balance exercise, and this is the one that you can do in the morning when you're making your coffee. So you can see he's holding onto his chair. You can hold onto a chair, you can hold onto your counter, but he's doing, it's like a flamingo pose. He looks like a flamingo. 1 foot is firm on the floor, and the other leg is up. So he's balancing right now on his left leg. He still has a hand on the chair for support, but the overall body is balancing on 1 leg. So this is one you can do while you're holding onto your buggy in the grocery store, while you're making your coffee, while you're brushing your teeth. Always just make sure you have something to hold on to for that extra support. Now the last one, they're the flexibility exercises. These also are very important for fall risk. So flexibility exercises help increase your overall flexibility and range of motion. Your goal should be to build to 3 to 5 repetitions at each session. And when you're doing the stretches, you should hold them for around 10 to 30 seconds. You want to start slow, stretch slowly and smoothly and as far as possible. But if you're stretching to the point where you feel pain, ease up just a bit. You should feel a little bit of uncomfortable feeling, but you should not have any pain. So if you feel that, just ease up just a bit. Now, your safety for the flexibility exercises, you always want to make sure you warm up your muscles. You never want to stretch cold muscles. That's when you could tear them or cause more injury. Make sure you're breathing during your stretches. Don't hold your breath. We see that a lot in the class that we do here. People's face will start to turn red. Well, make sure you're breathing. Don't hold your breath. Next one, make sure, like I said, you should feel a slight uncomfortable feeling, but you should not have any pain. It shouldn't hurt. If you feel the pain, if you feel that hurt feeling, reduce what you're doing. Reduce that stretch just a little bit until you have that just slightly uncomfortable feeling. You never want to jerk or bounce into a stretch, and don't lock your joints. It should be a slow and smooth stretch out and then back to whatever the original position is. Here's an example of a flexibility exercise. Again, you can do in your home. So you can see she has a sturdy chair with 4 legs flat on the floor. And she also has arms on the chair. So she's sitting around the middle. Her back is off the back of the chair. Both feet are flat on the floor, about hips width apart. She's holding onto the chair with her left arm and keeping her hips secure and straight, but she's twisting her torso and her lower back. Her right arm is holding onto the leg just for added support, but she's just pulling that back, twisting those muscles, feeling the lengthening of her side and back muscles. You want to make sure you're doing both sides. Again, you should feel a slight uncomfortable feeling, but you should not feel a pain. Now, this chart here is just showing some calories burned during exercise. You can see, let's see, the first one here we'll look at is golfing using a golf cart. So you're still burning 294 calories for a game driving your golf cart. Over on the right, swimming laps, 840 calories. Going for a walk, 378. Pickleball, 478. So no matter what you're doing, as long as you're moving your body, you're burning calories. That's what we want. Gardening, 378. So it doesn't have to be going to the gym, taking all of these classes. If that's not your thing, that's okay. You can still do other types of activities that are still going to be beneficial for your body and get your body moving. That's the goal. So when you decide, okay, it's time for me to start some type of physical activity routine, first you want to identify your starting point. Where are you right now? Are you doing any type of physical activity or exercise already? If not, that's okay. Identify where you are right at the beginning. You want to set some goals. So set a long-term goal. Maybe where do you want to be at in 6 months, 1 year, 2 years, even 5 years. But you also want to set some short-term goals also. What do you want to do by next weekend? What do you want to do by tomorrow even? Maybe if you're making your goals today, tomorrow you'll start them. So short-term goals are important. Make sure they're realistic and there's something that's personal to you and important to you. Maybe if you don't want to be that 1 in 3 people that fall every year, that's a good goal to avoid being the statistic. So make it something that's personal and important to you. That way you'll be able to stick to it. Then make a plan. So turn your short and long-term goals into a weekly plan. You need to be very specific and realistic with it, and also make sure your plan is something that you can measure and keep track of. You want to build upon your successes each week because that's going to keep you striving to reach your next goal. And then about every month, you want to reassess where you are because you have your starting point where you were before you even started any of this. So then reassess and see your progress. See how far you've come every month, and that'll be a great indicator to keep going to try to reach that long-term goal that you set. Also, make sure you set yourself up to succeed. You want to make exercise a priority. Maybe you want to put you a little calendar on your refrigerator or by your door of entry. Put some type of physical activity on the list to do every day. If it's not a priority, you will find excuses to not have to do it. You should make it something that's easy and fun, something that you enjoy. Pick up the pace a bit over time just to keep towards reaching your goal. You can even make it something social. Maybe ask your spouse, your friend, your neighbor, them to join in and be your exercise buddy. That's also a great piece to hold you accountable, to make sure you're maintaining your exercise routine and trying to get it in every day. And then make it happen. Choose to be active in a few different places and many different ways. If you stay walking on the same path every day, you're going to end up seeing the same people, the same trees, the same dogs, the same everything, and you're going to get bored with it. So make sure you're changing it up. Get you a different playlist, maybe get you a few different routes to go on for your walks. Even if you want to get a few different people, that's okay, because changing it up is going to keep you from getting bored, and it's going to keep you going. It'll keep you on task and keep you doing these exercises. And then when you reach those goals, reward yourself. Reward yourself when you reach your short-term goals, when you reach that long-term goal. That's a huge success. Recognize that you stayed on track. If you did get off track, you got back on and you still reach that goal that you set for yourself at the very beginning. And you also want to make sure you're focusing on the intangible successes that you maybe didn't have at the beginning. So do you have more energy? Are you sleeping better? Maybe taking fewer naps during the day? How about your mood? Is that better? Maybe your friends want to be around you a little bit more because you're in a better mood. You feel better about yourself. So those intangible successes are sometimes even more important than others. So celebrate when you reach those. And then once you start your routine, as you reach your goals, when you're ready, enhance them, enhance your activities, maybe go further or go faster than you were. Start adding weight, maybe reach farther when you're doing your stretching, or balance longer. These things you can just slowly build up over time. And then you want to also start adding new activities in your routine. That's also important to prevent you from becoming bored. You also want to set new goals. So once you reach that 5-year long-term goal, you don't want to stop. You want to keep raising the bar so you can continue to strive to reach those goals and keep going, because that's only going to better yourself mentally and physically. So in summary, for physical activity and exercise, you want to move more and sit less. You'll slowly build over time. You want to focus on adding days of exercise first, and then you'll start adding minutes to those days. Make sure you're staying safe when you're doing your exercises, and most importantly, have fun. Make it something you really enjoy so you can continue it over time. I hope you all enjoyed this seminar. If you have any questions or comments, please feel free to reach out to us at the Learning Center with the Villages Health. And we will hopefully have you join in for a few other seminars. Have a great day.